We knew that Medicaid was in danger, but now we're starting to get an idea of what that danger really looks like. This week, the Congressional Budget Office released new projections that show exactly how Congress could cut $880 billion from Medicaid. And I'm here to walk you through what that means for you, your family, and your community. Because it's not just numbers on a page. These cuts could touch everything from your medications to your nursing home coverage to whether or not you can get the care that you need when you need it the most. So if you rely on Medicaid or if you know someone who does, you need to hear this. And I'm going to be honest with you, this is a hard video for me to make, especially today. This is intensely personal to me right now. You can probably tell that this isn't my normal studio. I'm recording from a hotel room today because just yesterday I helped transfer my little brother into hospice care. The doctors say that he has about 2 weeks to live. If you've been watching this channel for a while, you may have heard me talk about him before. My baby brother was diagnosed with debilitating multiple sclerosis when he was just 16 years old. Without Medicaid, I honestly don't know how my family could have possibly afforded his care over the last 10 or 12 years. Medicaid has paid for his doctor's visits, his hospital stays, his medications, the years that he has spent living in an adult family home because he needed so much care. And now, in the final days of his painfully short life, it's paying for his hospice care too. Medicaid is so vitally important to my family and to so many others. But it is also expensive. We know that Medicaid costs about $890 billion a year. The federal government covers 69%, states cover the other 31%. This is one of the largest programs in the country. So it makes sense that when lawmakers are looking for something to cut, Medicaid ends up on the table. But I think to many of them, Medicaid is just a number in a spreadsheet. They don't see what we see. They don't know what it's like when Medicaid is the only thing standing between your loved one and complete catastrophe. People like my brother, my mother, and I, we understand Medicaid differently. And I think that's probably true for you too. So if you've ever needed Medicaid or if you know someone who has, could you just drop a quick yes in the comments and let me know I'm not alone here? I'd really appreciate that today. Now, you've already heard that the new administration wants to cut this $880 billion from Medicaid over the next decade. And since Medicaid costs about $890 billion every year, that means they're trying to cut roughly 10% of the total 10-year budget. That's not a small amount. That is a massive shift, one that could ripple through every part of our healthcare system. So now that we understand just how big this cut is, we need to talk about what it might look like in real life. So this week, the Congressional Budget Office, that's the nonpartisan budget experts in Washington, they released a report showing 5 specific ways that Congress might approach this. And what they found is alarming because these aren't just accounting tricks. Each one of these options would hit real people in real communities in very devastating ways. So let's go through them. Option 1, they cut the federal match rate for ACA expansion adults. Right now, if your state expanded Medicaid under the Affordable Care Act, the federal government pays 90% of the cost for adults under 65 who make less than 138% of the poverty line. If Congress rolls back that to the normal Medicaid rate, which can be as low as 50%, then states would have to make up the difference or cut the coverage. CBO estimates that this would result in $860 billion in reduced federal Medicaid spending. So it would get them almost to their goal, but 5.5 million people would lose Medicaid coverage by 2034, and 2.4 million of them would be left completely uninsured. And in some states, there are laws already on the books that would automatically cancel that Medicaid expansion if the 90% match disappears. This would eliminate coverage for tons of people overnight. Option 2 is to eliminate the state provider tax schemes. Now, many states collect taxes from hospitals or nursing homes and then turn around and give that money right back to the same people in the form of higher Medicaid payments. This lets them draw down more federal funds without actually spending more of the state's money. Congress is considering banning that practice. The CBO says that if this happens, it wouldn't directly change any Medicaid rules, but states would lose a key funding source and respond by cutting services and so on. They expect that if this happened, Medicaid enrollment would drop by about 8.6 million people, and 3.9 million of them would end up uninsured. Now, that's the single biggest coverage loss of all the 5 options that we're going to discuss today. Option 3 is to cap federal spending per enrollee. So today, Medicaid is open-ended. If the costs go up because more people need care or because someone needs more care than they expected, the federal government just keeps paying its share. Under this proposal, this option that we're talking about right now, every person would have a spending cap, no matter how sick they are or what care they would need. States would get a fixed amount per person. The CBO says that this would cut federal spending by about $792 billion, but it would lead to 5.8 million people losing Medicaid. It would leave 2.9 million without any insurance. And remember, this option means that the sicker you are, the faster you're going to hit that cap. So the people who need the care the most would be hurt the most. For people like my brother, who are entirely dependent on Medicaid for their survival, this option would be an absolute disaster. For option 4, we're talking about capping spending only for the expansion population. This is a narrower version of option 3. It would only cap the per person spending for the group that became eligible through the Affordable Care Act. But the cuts are still serious. We're talking about cutting almost $300 billion, dropping 3.3 million people from Medicaid, leaving 1.5 million uninsured. And then option 5 was to repeal the eligibility and enrollment simplification rules. These rules were finalized in 2023 and 2024 to make it easier for people to apply for and keep their Medicaid coverage, especially older adults and people with disabilities who qualify for complicated programs like the Medicare Savings Program. They would roll back these rules and save the government about $170 billion, but it would come at a steep human cost because over 2.3 million people would lose coverage, and about 60% of those are people who also qualify for Medicare. Under this change, they would still have Medicare, but without Medicaid to help cover those copays, premiums, or prescriptions, and that means they would face higher out-of-pocket costs. Now, many of those people would probably just stop going to the doctor altogether because they couldn't afford it. And that brings me to something really important. If you qualify for both Medicare and Medicaid, I want you to pay close attention right now, because Chapter is a completely free resource that helps dual eligible people like you get better coverage, lower your prescription costs, and unlock extra benefits you might not even know you are eligible for. So don't miss out on the help that's already available to you. Call our sponsor Chapter today at the number that you see on screen. It should be 417-319-2139, I think. Or visit lirlinks.com/chapter. Their help is free, and it could make a real difference in both your care and your wallet. But for now, let's step back for a second and talk about what these Medicaid changes that we're talking about today really mean, not just in theory, but in everyday life. Because if these cuts go through, people won't just lose coverage on paper. They're also going to lose access to doctors, to medications, to basic care. And for some people, that's the difference between staying stable and spiraling into crisis. So let's talk about mental health care, because this is one of the places where the system breaks down as soon as Medicaid is underfunded. So right now, Medicaid covers nearly 41% of inpatient psychiatric care in hospitals. That's a huge percentage. And in some places, like Iowa, over half of non-elderly Medicaid enrollees have some form of mental illness that they're dealing with. But there are never enough beds. There aren't enough providers. And when people need care, they end up sitting in emergency rooms for days waiting. Or worse, they're put in jail, not because they're criminals necessarily, but because there's just nowhere else for them to go. And it's not just about mental health either. Birthing units are shutting down because they can't afford to stay open. Nursing homes are laying off or completely closing. In Washington state, a survey found that just a 5% cut to Medicaid would force nearly 2/3 of long-term facilities to consider closing or drastically cutting their services. That is a huge impact. And we're not talking about hypotheticals here. These are people. These are your neighbors, your parents, your kids, your friends. These are people who greet you at the pharmacy, who care for your grandkids, who bag your groceries, who sit next to you at church. They're already doing everything they can to make ends meet, and now they're being asked to go without even basic health care. Even those who manage to stay on Medicaid will feel the effects of this, because when states can't afford to pay doctors a fair rate, fewer doctors are going to accept that coverage, and that's going to result in longer wait times, fewer options, a higher risk of being denied care, not because you're sick, but because no one can afford to treat you. We've seen in some states like Kansas where hospitals in rural areas are shutting down because they're just not busy enough, they're not bringing in enough money. And this is catastrophic as it builds and builds and builds. So I want you to understand too, there are ways to change Medicaid to make it more effective and even save money that aren't going to result in these catastrophic outcomes. There was a heartbreaking story shared in Stat News recently about a patient. He was an elderly man with heart failure who needed a simple lab test to adjust his medication. It wasn't anything complicated. But because his care was paid by Medicaid, his doctor had to use one specific lab that still required paperwork to be mailed in. That delay meant the test didn't happen in time. His medication couldn't be adjusted. His condition worsened, and he ended up in the hospital. That admission was completely preventable. It was expensive. It cost taxpayers thousands of dollars, but it could have been avoided. And this isn't rare. Nearly 40% of ER visits and hospital stays for Medicaid patients are preventable. We're spending about $36 billion a year on avoidable emergencies, monies that we could save if the system actually worked the way it was supposed to. And I've seen this kind of government red tape firsthand in my own life, and it's insane. Several years ago, I needed to have my wisdom teeth removed. I was in so much pain I couldn't eat, couldn't work, couldn't function. The dentist accepted Medicaid for the procedure, and that was supposed to help, but everything got all tangled up in rules. They couldn't schedule the surgery until I paid for the anesthesia, but I couldn't pay for the anesthesia until Medicaid refused to cover it. Everybody knew that Medicaid was going to refuse to cover it because they never cover it, but they required the dentist to ask them first. I offered to pay for it up front. I said, look, I'll borrow the money. I'll take care of it now. Let's just do this. I'm in pain. But the dentist said they weren't allowed to do that. They were required to submit the request and wait for Medicaid to deny it before they could take my money. So we waited. And it took nearly 2 months for Medicaid to come back with their denial. And then, and only then, was I allowed to pay out of pocket like we always knew I would have to. And then once I did, I had to wait another 3 months for the procedure. Months and months wasted in pain, unable to work, piling up medical bills, taking round after round of antibiotics that Medicaid paid for to treat infections that never should have happened in the first place if I could have just got the care that I needed. And it's so ridiculous to me because Medicaid wouldn't have had to pay for that stuff in the middle if they just didn't have those rules in place that stopped me from doing what I needed to do to get those teeth removed in the first place. But instead of moving forward with that, we all had to wait. We were stuck in the bureaucratic red tape nightmare that is often so common in these government programs. Anyway, that's one reason why I loved this article in Stat News. It really resonated with me. Because that same red tape is hurting people every single day in all sorts of different ways. Medicaid patients often face prescription denials for things as simple as trying to pick up their medication a day early. That might sound minor, but if it's a seizure medication or insulin, that one day can be the difference between stability and an ambulance ride. The ER can't turn people away due to inability to pay, so a lot of times what could have been affordable, preventable care becomes an expensive, unnecessary treatment in the hospital. And it doesn't really help the overall government budget. In fact, research from a Medicaid-focused care organization found that these kinds of procedural denials actually increase annual healthcare costs by over $3,000 per patient. And it's not just about paperwork, right? Some states are trying things like Medicaid work requirements or hoping to save money by trimming enrollment. But those experiments don't usually improve things either. They just lead to more medical debt and more people going without care. Anyway, the point is, there are better ways to fix Medicaid, but they don't come from cutting benefits or kicking people off the rolls. They come from common sense improvements that make the system work better for everyone, cutting out the red tape and all the procedural stuff that really just makes things cost more in the long run. One of the proposals that I saw in that Stat article was talking about value-based care, where providers should be paid and compensated for keeping people healthy, not just billing more for visits. Because instead of paying when people get sicker, we could actually incentivize them to help keep people well. We could also adopt more modern technology to help pinpoint when an ER visit is more likely to happen so that people can step in with preventative care instead. So here's an example of what I mean by that. Some people with diabetes experience low blood sugar during the last week of the month, not because of a medical issue, but because their SNAP benefits run out and they don't have enough food. So they keep taking the same amount of insulin, but without the meals to balance that out, their blood sugar crashes. Then comes the ER visit, the ambulance ride, the hospital bill, all of which could have been avoided with a simple food voucher or a conversation with a pharmacist, all of which would have been much cheaper than the ambulance ride and the ER visit. And then there was a lot of other information in there about community health workers and other things that I had wanted to talk to you about. But ultimately, I am running late and I do need to get back to my brother. So let me see. What else were we going to talk about here today? Sorry, just looking at my notes really quick. Okay, yeah, so community health workers. When Medicaid funds those and gets them embedded in Medicaid teams, they've shown great results in improving outcomes for a lower cost. They reduce ER visits by 20%, reduce hospitalizations by 48%, and save more than $200 per patient per month, and it creates local jobs. So that to me seems like a smarter way to trim the expenses without just axing and hurting the people who depend on this program. But of course, instead of moving in those directions, Congress is just talking about stripping coverage, capping care, rolling back these essential coverages that people rely on. So at this point, you're probably wondering, why would anyone vote for this, right? Why would lawmakers push policies that cut coverage, raise costs, and create chaos for millions upon millions of people? And the answer, of course, is politics. But the interesting thing that I read today that I didn't know before is that some of the same people pushing for these cuts are doing so at the expense of their own communities. For example, I read that Representative Marionette Miller Meeks from Iowa sits on the committee that is talking about Medicaid cuts. Her district includes 132,000 people on Medicaid. That's more than a third of her voters. And she won her last election by under 800 votes. That is way less than the number of people on Medicaid. And she's not alone. There are dozens of lawmakers in swing districts that are trying to balance the budget and sacrificing the care of their own constituents. And I think this means that we have a really good chance of reaching them and hopefully persuading them to do the right thing here. I think that's really important. And I know you're probably sick of it because I'm constantly on here lately begging you to reach out to your congressional lawmakers and make your voice heard. But I think this is really important because they count on you for re-election. In fact, a recent KFF poll showed that over 60% of Trump voters said Medicaid was very important to their communities. So this isn't even, this isn't isolated to one party, guys. There's people all over the country that rely on this program for their survival. And this isn't something that should be sacrificed in the name of politics. I don't think the people making these decisions realize what a dangerous game they're playing and how many lives they are gambling with as they make these decisions. I think a lot of them are hoping we won't notice, that we'll be too busy or too overwhelmed or too tired to speak up, that we're going to stay quiet, that it won't affect their re-election prospects. I think they're counting on that. So I think it's time for us to get loud, because we're not just talking about budget math here. We're talking about real people like my brother. Medicaid isn't just a line item. It is 63% of nursing home residents, 42% of all births in the United States, and health care for nearly half of all the children in this country. These cuts would take health care away from millions of our most vulnerable neighbors. They would raise costs for the rest of us. They would force clinics, nursing homes, hospitals, and mental health units to close or downsize, especially in rural and low-income communities. So the AFL-CIO estimates that we could lose nearly 500,000 healthcare jobs just in the first year of these changes. We can't let this happen quietly, guys. That's why I'm asking you right now to reach out to your representatives. Let them know that you're paying attention, that this matters to you, that you vote, and that you expect them to protect Medicaid. You can do that call in less than 2 minutes. On the AFL-CIO website, they have it set up so that you can simply dial 231-400-0602 and say, I'm calling to tell my representative no cuts to Medicaid, not now, not ever, and then you're done. That one call can help make a difference. So please do that today. Do it for you, do it for your family, do it for people like my brother who wouldn't be in hospice care right now if it weren't for Medicaid. I have no idea what would have happened to him without Medicaid. I wanted to do a Q&A today, but I really do need to go and get back to my brother. So please don't forget to check out our other videos for more ways to save money and get free stuff. I really appreciate you guys. Sorry that I rambled today. You're wonderful, and I will be back soon. Have a great day.